We are the most overprescribed, overmedicated, overtreated population to ever walk the history of the earth.
What did you see inside the healthcare system in the United States that made you say, I just can't do this anymore?
U.S. employers spent $1.3 trillion covering 164 million Americans with healthcare benefits. 25% of what they spent last year was completely wasted.
Where does the corruption start?
Brokers are double agents. That's why they make more money when costs go up, not down. They get paid to sell insurance. That is a very different value proposition than helping businesses.
Is it fixable considering how deep the corruption goes?
Healthcare is now most companies' second biggest cost after payroll, and most leaders have no idea how much money they're wasting. My guest today, Donovan Pyle, is a health insurance whistleblower and author of Fixing Healthcare, who has been fired for telling the truth and now helps companies save thousands of dollars per employee while actually improving care. If you think your healthcare broker is on your side, you need to hear this. Donovan Pyle, welcome to the EOR podcast. Let's go.
Hey, everybody, welcome back to the Effort Over Results podcast. I'm your host, Quinn Magnuson. Today, we're going after a topic that quietly is crushing businesses, families, and employees: healthcare. My guest, Donovan Pyle, is the CEO of Health Compass Consulting and author of Fixing Healthcare: How Executives Can Save Their People, Their Business, and the Economy. He's a former benefits broker who saw the waste, fraud, and misaligned incentives from the inside and got fired for pushing too hard on behalf of his clients. Now he helps companies with 100 to 10,000 employees cut unnecessary healthcare spend, often saving thousands per employee per year, while improving the quality of care their people receive. We're going to talk about how the system really works, what leaders are missing, and how you can turn healthcare from a runaway cost into a strategic advantage for your people and your business. Donovan, welcome to the show.
When it's fantastic to be here. Thanks for having me.
I'm going back to a quote and the origin story, the whistleblower moment. You've said working in traditional benefits felt like, quote, having a CPA who gets paid by the IRS. Take us back. What did you see inside the healthcare system in the United States that made you say, I just can't do this anymore?
U.S. employers spent $1.3 trillion covering 164 million Americans with healthcare benefits. That's about half the country. But here's the thing. 25% of what they spent last year was completely wasted. That's $325 billion, or down $4,000 per employee last year, completely wasted. And there's very good reasons for this. So, what I experienced while working on the carrier side of the insurance business, where benefits brokers were my customers, and then, I transitioned to the broker side of the industry, was that brokers are retail distribution partners for insurance companies. They get paid to sell insurance. That is a very different value proposition than helping businesses maximize the return on their healthcare investments. And that's why I said this system is completely unsustainable. The incentives are completely misaligned, and we need to develop a new business model to really align ourselves with employers and patients to help them achieve their objectives.
So is a fully privatized system like the American system just wrong from the start? Because you're talking to someone in Canada who comes from, a national healthcare system or an NHS in the UK. Lots of countries around the world have basically Medicare for everybody. And we as Canadians laud that as one of the greatest things ever created. And it really is. And there's a lot of Canadians who would love to see an American system. But is that fully privatized system fixable considering how deep the corruption goes and how in bed the top three players are?
Yeah, it's a great question. And I'm very intentional with the scope of my book on addressing what exercising. It's basically the executive playbook on how executives can exercise the power that they already have. Most of them don't even know that they have the power let alone have the playbook on how to exercise it. So that's exactly why I wrote this book. The scope of the book is not to talk about, have theoretical conversations about, if we started from a clean slate of piece of paper, what would be the ideal system? It's a fun thought experiment to have those conversations, and I'm happy to have it. But people very quickly realize, wow, central planning is really difficult, and that's why it usually fails. The point of this book was to say, here is the power that executives already have, and here's how you can actually exercise it to solve these problems. And what I'm talking about is not theoretical at all. And that's why I was very intentional about putting a number of case studies in the book of real companies that have already done this. I live in Orlando, Florida. I was inspired by a gentleman by the name of Harris Rosen, fantastic entrepreneur, started Rosen Hotels in 1974. In 1990, he got fed up with the traditional way of financing and procuring healthcare for his employees. And he said, screw this. I'm firing my broker. I'm firing my insurance company. I am done. I'm going to do this my own way. Over the next 30 years, he pioneered different ways to finance and procure healthcare for his employees, saving his company over $500 million over the next 30 years. Not only that, he did it by providing a superior health plan to his employees, so much so that his turnover rate was a fraction of what his competitors is in the hospitality industry, which, as you probably know, has a rampant turnover problem. So that was really the catalyst for me when I was, on the insurance side of the equation. Benefits brokers were my customers. I was saying, why aren't these guys at least recommending some of the strategies and solutions that Harris Rosen had pioneered years ago? Where oftentimes the employers I was working with, they're in the same area, they could do the same exact thing. And it all comes down to incentives. Benefits brokers are retail distribution for health insurers. They make more money when costs go up, not down. That's a problem.
So I want to dial it back a little bit in the sense of taking our audience to really truly understanding the foundational level of healthcare, what's covered, what isn't, the concept of insurance brokers, big
Yeah.
pharma, even
Yeah.
just literally even the medical complex of the United States. So you were speaking directly about executives and companies and benefits for their employees, but let's boil it down first, Donovan, specifically to just Americans in general.
Yeah.
And because once again, I'm speaking from an outside lens from Canada, and it seems to me like Americans stress more, and it actually causes them more medical distress to deal with, where their medical insurance is coming from. Who's handling it. Can I go into this hospital? No, I need to go to that hospital. I can only see those doctors, but not these doctors. And both my kids and myself lived in the United States, going to school there for years. And it was like, it's almost like they try to confuse the end user so they can just gather more money out of it. And so where does the corruption start? Because I'm a former history teacher, and once again I go back to the Rockefeller years and how
Yeah.
all the medical students were basically taught prescriptive medicine, not preventative medicine, and how they were basically told to basically just keep feeding pills to people. And it seems like that hasn't changed a whole lot. So let's go back to my original question. Where is the corruption starting, and how does this bleed up to the brokers and then obviously onto the end user?
Fantastic question. So I have a whole chapter dedicated in my book to the history of the industry because, as you mentioned, it's really instructive. Again, executives, finance teams, HR teams, who again cover half the U.S. population, make purchasing decisions for half the U.S. population. If they don't understand this landscape, they have almost zero chance of making effective purchasing decisions, right? It's really difficult to navigate this landscape if you don't understand it. So let's talk about the history briefly here. So up until, in the year 1900, the average American spent more on cosmetics than they did on healthcare. And that's because the healthcare industry couldn't really solve anything. They couldn't cure people. They didn't have the ability to do it back then. And so people that weren't looking for healthcare, right? So they spent more on cosmetics than they did on healthcare. About $5 a year was what the average American was spending in the year 1900.
Hmm.
Now, through the 1910s and 1920s, when medical advancements came to the fore, and these hospitals actually started to be able to cure things, their cost basis also went up, right? They were training doctors, they were sterilizing hospitals, they were building new hospitals. Their cost basis started to go up. And this created a real problem when we got into the Great Depression, where health insurance didn't exist back then. There was no need for it, right? And so and so their patients oftentimes were not able to pay for their services that were being provided. And so, the Baylor University Hospital in Dallas, Texas had a great idea. What if we got a large employer to prepay for our services? Okay, so this is in 1929, and they partnered with the Dallas Teachers Union, and for 50 cents per employee, those Dallas teachers could come to this Baylor University's nice, clean hospital and deliver their babies. And that was a huge success for the hospital. It allowed them to stabilize their revenues, which was a big, big deal back then. And so, you know, over the next 10 years, hospitals executives from across the country saw this success and they said, wow, well, how can we build our own health plans, right? These health insurance plans. And so here's the kicker. These hospitals, in many cases, actually put up the seed money to found health insurance companies, right? They actually invested in controlling the distribution and actually creating a wholesale arm for their services so that they could stabilize revenues and grow their revenues. And so all of these health plans throughout the 1990s became known as Blue Cross. Okay. And so by 1940, there were 14 Blue Cross plans across the country, and they were growing rapidly. So that's the wholesale side of it. Health insurers, health insurance companies, and hospitals, they are partners. Okay. Without that distribution arm, you really don't have a business. Okay. So that's a critical thing to know. And especially when we're talking about the commercial marketplace where employers buy health insurance from. We have this, you've probably seen this in Canada, that in the United States, there's this fight occasionally between a hospital and a health insurer where they're arguing about a contract, right? That's all smoke and mirrors. At the end of the day, they both make more money when costs go up, not down. Okay. So it's all smoke and mirrors. They almost always settle, right? And they won't tell you publicly how much they settled for or what the increase is going to be, but they almost always settle. Okay, so that's the wholesale side. Let's talk about the retail side. Up until 1938, these health insurance companies had in-house salespeople, right? And they were to get paid a commission on for selling each product. Pretty standard stuff. Okay, fine. When the federal minimum wage laws went into effect in 1938, this posed a problem because, hey, like most sales organizations, half the people don't really sell anything. We don't want, as the insurer, they don't want to have to pay these people a minimum wage when they're not really selling anything. So let's do this. Let's reclassify them as 1099 subcontractors. So they did that. And what that did unintentionally was that it allowed these salespeople to not only sell one insurance company's products, but multiple insurance companies' products. And so by default, they kind of inadvertently created the brokerage industry. That was the dawn of the brokerage industry. But here's the thing, Quinn, there's confusion. Employers, again, because they don't have expertise in this area, they expect brokers to help them maximize their investment without realizing that brokers are double agents. They get paid by insurance companies and pharmacy benefit managers, and that's why they make more money when costs go up, not down. They are the retail distribution arm for health insurers.
I'm still confused. It's a system that continues to, as I said before, Donovan, deliberately confuse people.
Yes.
And there's obviously everyone is in it for themselves and everyone's trying to profit from it. And I understand the capitalist system in the United States and how it works, but it feels like, and this isn't just the health industry, but like there's a lot of industries like this where the end user is the one that ends up just taking the brunt of all of it, right? And the cost of all of it. Is medical health insurance and health benefits in the States, can it be simplified to explaining it to someone, once again, who's not from there, as to, like, if I were to move to the States, what would you recommend? Because it seems to me like it would still be just as confusing as heck. and where people would get it, or what their company even offers, right? Because even in Canada, obviously every company has health benefits for their employees too, but it's different in America. But how would you simplify the health insurance industry for someone who didn't understand it? Like, is it tiered? Is it like gold standard, mid standard, and you're barely getting covered? Well, how does that all work for the average American citizen?
This is America. We've got 500 different kinds of cereal. You don't have to play this game at all. Okay. So just for example, and I'm not recommending other people do this, but I'm saying this is what's been a great decision that my family made was that in 2019, we stopped buying health insurance. We stopped buying it. We checked out of that system, right? I had just started my business in 2018 and our first child was born in 2019. Up until that point, we had traditional health insurance, right? We had, major carrier. My son was born while we had that major carrier. I fought balance bills for the next 2 years, right? Even though we had health insurance, I had to pay $10,000 out of pocket and we were looking at $25,000 in premiums for covering a family. And I said, this is BS. It doesn't make any sense. And and there's other ways to do this. So we stopped buying health insurance right after that. And what we do is we joined a health sharing organization. There's a lot of them out there. They're all different kinds for different kinds of people, whatever you want to do. And we pay cash. So the health sharing organization basically just protects us in the case of catastrophic events, right? Almost meeting the definition of real insurance, right? Unpredictable catastrophic events. That's what insurance is supposed to be, right? Everything else we just pay cash for, and I love it. Here's why. I got it. Just for example, I bought an MRI for myself 2 weeks ago for $400 because I know how to buy it. I know how to find deals like anything else. Make a market driven decision. So many employees in this same neighborhood are buying the same MRI for $4,000 because they're going through a health insurance company who cuts that deal and gives them a discount, as part of the health insurance package. But here's the thing, going back to my previous point, health insurers are distribution partners for hospital services. They are not in the business of actually helping you manage your healthcare supply chain. And so the mistake that so many businesses make, again, this is why I wrote the book, is that they're delegating the management of their healthcare supply chain to brokers and health insurers who have no financial incentive to actually do that well on their behalf.
Why wouldn't the situation you placed yourself in by just jumping right out of the game completely and then going to this health sharing system? Why doesn't everybody just do that then? Because to me, you just sold me, and I understand how this works. Because here's the thing, Donovan, even in Canada, obviously, even though we have medical coverage across the board, if I want to get an MRI, for example, I either go to my doctor, who then has to put me on a list for a specialist, to see a
Yeah.
specialist, so that they can recommend me for the MRI, which might get me in 3 to 6 months. Now, depending on the emergency of you know, the situation, but pretty much it's a waiting list. And that's what Americans will say about the Canadian or the NHS in the UK is, well, yeah,
Yeah.
but you guys have waiting lists that are like 6 months. Sure, we do. But
Yeah.
there is a system here now that allows for I can go and just pay for it directly.
Yeah.
So it's kind of a hybrid system, which I'm kind of enjoying, but at the same time, our taxes, our federal taxes, and then each province has its own, is still through the roof. Like, we're looking at 20 to 40% federal and provincial tax on your income because it has to cover this system.
Yeah.
And this is where people, even in Canada, but obviously the Americans, would say, what a horrible system. I'm paying for other people to go to the doctor, basically. I get it. So this sharing health system, tell us more about that and why that seems to be, obviously you've decided it's the best fit for your family, but why would it maybe be the best system for
I, I, I don't think there's a best anything for
yeah,
anyone.
true.
I disagree with that premise because everyone has their own standard of value, right?
And their own
For you,
standard of health too, right? If you're a family who tends to be sick and constantly needing to see doctors, it may not be the best system. I get it. Yeah.
yeah, exactly. I mean, your standard of value is that you want convenience, right? So you're willing to go outside the system to pay cash to just get it done. right? And as someone who's, approaching 50, that makes sense for me too. I'm willing to do that and happily do it. So I don't think there's ever going to be a one size fits all. In a country of 330 million people, I don't think a one size fits all solution will ever make sense. We don't do it in anything else, and I don't see why we would do it here. And I would also add, what we don't people think we have a market-based system here. We really don't. Okay. The federal government, covers about half our population. About half of our health systems are nonprofits. They have nonprofit status, but yet they charge just as much for hospitalization, surgeries, labs, imaging, etc. Their CEOs make the same amount of money as the for-profit systems. We have an economic freak. That's what we have in this country. It's not socialist. It's not market driven. It's a total hybrid, which does not, and in my opinion, that is the worst economic model. Mind you, we have the same thing in housing. Look at what caused the housing debacle in this country in 2008. Fannie Mae, Freddie Mac. We were artificially distorting the price of risk and the price of money, and it all came crashing down. So I just, from a regulatory perspective, I think we have to look at the past to learn some lessons about the root causes of these things. And I just, again, like it's fun. It's interesting to have these kinds of conversations. But the reason I wrote this book was to say, listen, executives, here's what you can do right now without any action from Washington, D.C. It's a $300 billion a year opportunity hiding in plain sight.
So getting back to my original question of, and your claim of fixing the system, and as an outsider, I look at it and go, this is just unfixable. Like literally you would have to tear it all apart and rebuild it. But let me ask this question, because it seems to me that the healthcare industry is in bed with big pharma, who is corrupt, in my opinion, for the most part, and they're in bed with the federal government. So, and I'm not talking about this sitting president and his administration. I'm talking about any of them. There's just this nasty trifecta of scratching each other's backs at the expense of the American public. And this is where I feel like it can never truly be fixed. So maybe the system as it sits can't be fixed, but maybe there are what I'll call workarounds. You found one for your family, but are there ways for people to circumvent that corrupt system and find their own way, or is it just this maze of cobwebs and birds' nests to try to get through?
Yeah, great question. So, my uncle was skeptical about my book, and rightfully so. And so he ran it through. He asked, ChatGPT, is Donovan Pyle right or wrong? Right? He put my whole entire manuscript through ChatGPT, and so it mostly agreed with my analysis. It had the same criticism as you, is that the scope of my book is not about system-wide systemic problems. It's about the playbook, the power that executives have right now, and how they can solve these problems using the power that they have right now. And that was very intentional. So there might be a follow-up, who knows, on, what voters and legislators need to know in order to solve these problems at a system-wide level, not a company-wide level. So that might be the follow-up. But I agree with your point that yes, we have this very corrupt, all this backdoor money that influences policy. As far as drug manufacturers go, listen, there are some deep structural problems with patent law in this country that facilitates a lot of these issues that we're seeing. Mind you, though, drug makers only make 30 cents on the dollar. Okay. Only 30 cents of what we spend on drugs is actually going to the drug maker. The rest is going to a lot of other people in the middle. So as a business, as a consumer, how do you navigate this, right? So as I mentioned, Harris Rosen was a pioneer in showing us how to buck the conventional system and draw a straight line to the source of what you want, which is healthcare, right? Not health insurance. Health coverage and healthcare are two different things. They're two completely different things. So, one thing that I think a lot of people don't understand is that in the commercial marketplace, the commercial marketplace is driven by networks, PPO networks, and I think you've alluded to this talking about your family in the United States, which doctors you can go to. So let's talk about networks for a second. Networks are a relatively new phenomenon. They've only been around for about 40 years. Health insurance has been around for about 90 years. And networks, when people think about networks, they typically think about, okay, the network dictates which doctors I can see, which hospitals I can go to. And that's true for the most part. But the part that people don't think about when they talk about networks is that the network is actually a prearranged contract between your health plan and the healthcare provider on how much the health plan is going to pay them. Okay. And this is really critical because we're talking about the unit costs of the care itself, right? How much are you actually paying for hospitalization, surgeries, labs, imaging, and drugs? And so if you're using a PPO network, it's that contract that dictates in advance what the discount is going to be off of the bill charges. Now, here's the dirty little secret. These legacy networks, they work on a discount basis, okay? But the discount is off of infinity, okay? It's like, this is like, we have such a perverse market that I live in Orlando. Healthcare prices vary over 1,100% in Orlando, Florida. You don't see that in any other industry. You just don't, because you have a functioning market where consumers can actually see prices and there's indications of value, right? And there's these feedback loops that happen in market systems, right? And in healthcare, the whole legacy system is designed to hide the price. So if you want to get more value for your money as a business, one of the first things we help businesses do is actually gain visibility to their supply chain. Put yourself in a position where you can actually see your supply chain. And then once you see it, you can actually start managing these things. And that's where the magic happens.
Whew. So this is why I don't move to the United States. Like, it just, like I said, it boggles my mind, and for most Canadians it does too. But here's a question I want to ask Donovan: is where in the family income range do do people get hurt the most? And what I mean by hurt the most is, correct me if I'm wrong, it sounds like there's a certain threshold of people under a family income or individual income where they actually are, they are provided, medical aid, healthcare regardless, okay, because they're below a certain threshold. Then you have the people who are, let's say, above a certain threshold, who can just afford insurances and afford in private care. Is it middle America? Is it that, let's say 60,000 to 120,000 in family income that are the ones that are the most confused, struggling the most because they don't just get free health care because they're not low enough and they can't afford the high stuff, the gold standard? Who really is being caught in this loop and being hurt the most?
Yeah, I would absolutely agree. It is middle America that's paying the brunt of this. I mean, yeah, if you're familiar with David Goldhill's work, his landmark book in 2013, Catastrophic Care, details this, that at least in 2013, 30% of the average American's lifetime working income is going towards health insurance, health care, and health insurance taxes. 30% of your lifetime income is going towards that. So, but let's just take a step back, because we have different market segments here, all right, in the United States. So if you watch the news, which I don't recommend for anyone's health.
I stopped during COVID, so how about that?
Call. Yeah, in my opinion, it usually has negative value. If you watch the news, all they talk about when they talk about healthcare is the individual marketplace, which is Obamacare. And Obamacare, yes, had some really, landmark legislation that affected not only the individual marketplace, but also the commercial marketplace where employers buy healthcare. So the individual marketplace, if you're self-employed, it's about 5% of our population, about 20 million people that caters to, that they buy individual health plans, right? And so yes, in the ACA, the Affordable Care Act marketplace, if you don't make that much money, you can get a subsidy to pay for part of your premiums to the publicly traded health insurers. Guess who engineered all this? The publicly traded health insurers. They wrote the bill. They essentially wrote it, right? I mean, it's like, talk about a great business model. You're forced to buy this product, and you're forced that you're going to force taxpayers to actually subsidize the paying for it. What an amazing, what an amazing business model. So that's that part. And then you've got 164 million Americans that are covered by their employer. And it's the employer that makes these company-wide decisions. Here's how we're going to finance and procure, buy healthcare for our population. Here are the contracts that we're going to use. Are we going to delegate the management of our supply chain to an insurance company? Most companies do that. And that is a fatal mistake. That is asking the fox to guard the hen house, because insurance companies make more money when costs go up, not down. I know that sounds really counterintuitive, and that's not the narrative that you hear in the news, but it's absolutely true in the commercial marketplace that covers half the population.
Let's talk about the people outside the industry that are really starting to poke holes in the corruption, poke holes in the industry, and really what it's doing to the average American. I'm going to throw a couple things at you. Number one, it feels to me, and probably not just to me, but a lot of people, that the advent of social media and the ability to gather information and research information in terms of your own preventative health care, health and fitness influencers, medical influencers for that matter, people who are, I'm taking literally the impression I get, Donovan, is it's like we're back during the feudal times where you wanted to keep the people on the farms dumb because
Yeah.
they couldn't uprise, right? And then
Yes. And,
once they
and
get
slightly buzzed.
yeah, and once they gathered that, they were like, they learned to read and they started getting educated. It's like all hell broke loose, right? That's
Yep.
kind of what it feels like today with healthcare, is that you've got these fitness influencers, health and medical influencers on YouTube, on different channels, platforms that are providing information, even yourself, providing information to the average American saying, listen, you don't have to do it this way. You can do it this way. If you take care of yourself, you'll spend less time in hospitals. What's your take on that particular group and how much it's chipping away at the corruption and the current healthcare system?
Yeah. I mean, I think there's a growing number of people who are, yes, absolutely.
Like Andrew Huberman, Peter Attia, like all these influencers are basically telling people, like, if you do these things, now you have to get people to do those things, but do these things and you'll spend less time and less money on insurance, on pills, on prescriptions, and whatever, because really it is up to the average person to just take care of themselves. That's where
100%. And yes, we are the most overprescribed,
Mhm.
over-medicated, over-treated population to ever walk the history of the earth. And it's just because it's healthcare doesn't mean it's good for you. Okay? I mean, just to give you an example, the American Medical Association, this is the association that issues board certifications to physicians. There is so much over-treatment because of the legacy business model, which goes back to your original question, how we started the interview,
Mhm.
that there's so much over-treatment that it causes harm, right? Everything you do, whether you're taking a pill, you're getting a procedure done, you're getting an image done, there is the potential for harm. And over-treatment is so pervasive in our country that in 2012, they did something completely profound. They created an initiative called Choosing Wisely. They created best practices for patients. 5 questions every patient needs to ask their physician to protect themselves. All right. So things like, is there something simpler? Is there a simpler treatment? Is there, how much does this cost? Right? Because if you bankrupt the patient, who cares that they're healthy? Right? I
Yeah.
mean, it doesn't matter. Um, what if I do nothing? Right? I mean, simple questions like that, that the AMA created this whole campaign around in 2012 to protect patients from over treatment. And so, Dr. Marty Makary, who's now the head of the FDA, wrote a couple of really great books on this topic. Outlines in one of his books that, hey, Medical error is the third leading cause of death in the United States. The most conservative estimates, there are over 250,000 people a year in the United States die from medical error. So just because it's healthcare doesn't mean it's good for you. You have to, you know, put your consumer hat on and ask the questions, and don't just assume because it's your doctor that they've got time and the resources and the expertise to recommend the right things to you. To put a pin in that point, there's been huge consolidation around health systems, large hospital systems who are buying up independent physician groups in the United States over the past 10 years. They are not doing that for their clinical value. They are doing that to control the supply chain because healthcare, I mean, I'm sorry, primary care in this country is a loss leader. They buy it, they buy these PCPs so that once they own them, then they can say, listen, now that I own the front door to the rest of the supply chain, the PCP is going to direct traffic to high margin services like imaging, labs, drugs, etc. That's why they're buying them. So as a consumer, you have to know that. You really need to know that. If your primary care doctor works for a large health system, that's the environment they're in. That's why they're there. They got bought by the health system to direct you to high margin services that you may or may not need.
Something that came up when you talked about, what the doctors were being trained on in 2012, and moving forward. But I think there are a lot more Americans and Canadians for that, and I'm one of them, that go into their doctor now almost armed with information. It used to be, and I'm going back to, let's say the 1990s and earlier, but you just went in, you trusted your doctor to do the right thing. And doctors out there, I'm not trying to bash the industry. What I'm saying is that you trusted your doctor, but we are in such a flux of uncertainty and mistrust in your country, America, even in Canada, around the world. Anyone in a power position, so people mistrust teachers, people mistrust the media, they mistrust government, they mistrust doctors. Like, there's just zero trust out there. So that's what I'm saying about the influencers basically arming the average citizen with information to go to their doctor and say, hey, I think this is a good treatment for me. What do you think? Do you have any insight as to that situation and maybe how doctors are taking that? Because my understanding is that doctors are hating it. Like, they don't like when you come in and you challenge them or ask them about a new treatment that's out there because you did the research and they haven't done it. Because it seems to me like the professional development that the medical system and the doctors are doing is largely run by big pharma and the insurance companies. And when they do go to these conferences and so forth, they're just being taught more prescriptive medicine. Big question, sorry, Donovan, but do you feel like doctors are kind of caught between a rock and a hard place? Because there's hundreds of thousands of brilliant, great doctors out there, but it feels to me like they're trapped.
I agree, and I agree with your sentiment that we're not criticizing the people, we're criticizing the system.
Yeah.
And this is my argument against the insurance industry as well. They're good people, but they're caught in a legacy system that doesn't meet the needs and the objectives of its customers. Okay, so yes, I mean, and if you talk to physicians, most of them, they're very unhappy with the system the way it is. They don't like it either. Yes, they probably don't like these more informed patients that are come in. They probably don't like these disinformed patients who have seen the commercial for the $100,000 specialty medication saying, "Hey, I think that could be for me. Can you write me a script for that?" They don't probably like that either. So it cuts both ways. But I think the main takeaway is that the system, the legacy architecture of the system is not supporting the supply side either in a way that they like it. They call it moral harm or moral injury, what they have to deal with as providers. So yeah, I think there's an inherent alignment between forward-thinking patients and forward-thinking clinicians who actually want to get together, cut out these middle pieces who act as wedges and actually solve these problems themselves. Honestly, there are little pockets where this is happening. Absolutely. I mean, you see the direct primary care movement where physician groups are saying, no, we don't want to deal with insurance anymore. We're going to partner with a large employer and we're going to serve that population. And sometimes we'll even take on risks to do it, right? We'll guarantee that we keep costs in this population, healthy by these certain KPIs, et cetera. And so that's great. So, I mean, I think we're just at the beginning of that innovation curve. I don't think we're at a tipping point yet. Others in my space think we are. I think we're still a little bit early for that. But there's definitely an alignment between forward-thinking patients, employers, and forward-thinking clinicians.
Mhm. What's your take on Mark Cuban's cost plus drug company?
Yeah, so I love having Mark Cuban's voice in the room because he has such a large platform and he's able to raise so much awareness on this critical topic, which frankly, people, I mean, to your point, I mean, it's very confusing. It takes a lot to unravel and understand the industry. And I'm very happy that he's been quite vocal about it. In fact, I have a case study in my book about him and his organization. So, what's interesting, and I had a post about this the other day, basically alluding to that. This industry is so backwards and corrupt that if anyone who just dares to say who they serve and how they get paid is looked at as some like courageous advocate, like it's like this courageous act of defiance to just tell people how you get paid and who you serve, which is what companies like mine do. It's like we're like these heroes. It's like, no, this is just like basic market stuff, but anyway, so his business model is it's as he's discussed, it basically runs on trust and transparency, right?
Mhm.
That's his secret sauce. Whereas when you're talking about the big three legacy pharmacy benefit managers, who we can talk for hours about them, it's a very opaque um, practice what they do. Their contracts are about 175 pages. That's by design. That's
Mhm.
to confuse the end user,
Yep.
the employers who buy these things. So, his business model is very simple. I'm going to buy a drug for X amount. I'm going to mark it up by 15%. And then anyone who wants to, whether it's an employer or an individual patient paying cash, can buy it. Very simple. Now, do I think would it be better if he made it Mark Cuban's fee-based drugs? I think that would have been better than cost plus drugs, and here's why. Basically at the end of the day, if when drug makers increase their prices, he makes more money.
Yep.
So, he's still a supply side vendor in that way. So he's doing it in a much better way than the legacy pharmacy benefit managers are, but that's a pretty that's a pretty low bar to exceed. So I love what he's doing. I think I'm sure he's got very valid reasons for having a cost plus model, but cost plus has its challenges. It doesn't align you with your customer as much as if you were just fee based.
Yeah, I mean, correct me if I'm wrong. My understanding is because, and this is just my research, and maybe it's bro science, but it's like the the average pill, the average prescribed pill, and whoever makes it, Pfizer, whoever, they're making these pills for pennies on the dollar and selling them for dollars on the dollar. And my understanding is that Mark Cuban is basically purchasing these at the pennies on the dollar cost, right? Like it's almost like when Kirkland Costco, right? Costco purchases millions of dollars of, olive oil and then slaps their label on it, right? Because they're buying millions of dollars worth of, they get it at a much greater discount. Is that not how the cost plus Mark Cuban system works? Is he's buying these pills, like these medications, at like the lowest cost possible, and then just the 15% markup because he's buying so much of it all at once? Or no?
Yeah, so I mean, I mean, he certainly doesn't have nearly as the volume as the big three pharmacy benefit managers. So let's
Right.
talk about the business model, though. And
Sure.
I hate to go into the weeds, but you have to go into the weeds and the
That's what we
details.
do on this show, by the way.
Okay, perfect. So let's do it. So just a little bit of historical context. Pharmacy benefit managers were originally developed to help employers manage their drug supply chain. So originally they were doing the same thing as fiduciary based consulting firms like mine, who we, in our contract serve as a fiduciary to the employer. We have to give them recommendations, financial advice that's in their best interest under law. Okay. that was the role that pharmacy benefit managers had pertaining to drug supply chains back in the late 60s, early 70s. Um, that dynamic flipped when when a when a large drug maker bought the biggest pharmacy benefit manager. I think it was in the late 80s. Okay. So they flipped sides. They went from protecting the consumer to now we're serving as distribution for the drug makers. Right. They flipped to the other side of the table as far as what their role is. And so when they did that, they said, "Hey, listen, Mr. Employer, our services are free. Here's what we do: we just mark up the cost of the drugs, and we don't even charge you a fee. We don't have any fees. There's no fees. We just mark up the cost of the drug." Now they probably started off just like Mark Cuban's company, right? We're going to take 5%. We're going to mark it up 5%, 10%, and then that grew up to 500%, and then 1,000% in some cases. So in these contracts with the legacy pharmacy benefit managers, they're marking up the drugs by undisclosed amounts that you as an employer you'll never know. You'll never have visibility to it, and so really, again, they serve as distribution for the drug makers. That's why, and they have so much market share that the drug makers have to play ball with them. Otherwise, they're going to lose a huge swath of market share. So that's the historical context. PBM started off as actually sitting on the same side of the table as the employer, helping the employer manage these drug supply chains, but then flipped to selling drugs, which is a different value proposition.
Is that what your role was when you quit?
So as a broker, as a former rehabilitated broker, my my role was to sell health insurance products, and by proxy, I'm selling hospital services and I'm selling drugs. That was my role. You're acting as retail distribution for supply side vendors. In my current role at Health Compass, our job is to protect employers from the insurance and medical industrial complex, help them navigate these very complex landscapes, and help them maximize their investment. That's what we do now.
I believe the term disruptor comes to mind. In a
Yeah,
very positive way, and I love that, Donovan, that you're a disruptor. Another name that comes to my mind when it comes to disruption of this medical complex and pharmaceutical is Brigham Bueller. I don't know if you're aware of him.
sure.
The
Yeah,
owner of Waste to Well. Yeah, and not just you, not just him. There's many of people out there that have finally just gotten sick of this. And I know that he basically quit his job. I believe he was a PBM as well. And decided, like, I can't do this. Like, it's just
yeah,
immoral and unethical. Which I
yeah.
believe is, kind of where you came from. And you were literally fired for telling the truth about how a plan was hurting your client, correct? So let's talk about that story. What happened there? How did that moment shape the work you do now?
Yeah, so I very naively got into the brokerage side of the business thinking that I could scale the solutions that Harris Rosen had pioneered years before. And I thought, geez, if I just move to the brokerage side of the business, I can scale those solutions. I can probably help a lot of people and I can probably make some money doing it. And I very quick, after building a book of business at a brokerage firm, I very quickly realized this is not the mission of the organization. Their job is to sell insurance for X, Y, and Z carriers. Their job is not to help businesses maximize their healthcare investments. It's a very different value proposition. So, I was fired for quote being too hard on an insurance company who I found out later actually paid them their largest bonus each year. Okay. And so it was like, okay, well, here's the crazy thing, Quinn. I should have known better because sometimes you're so close to your own story, you don't even see it. And towards the tail end of my tenure at a multinational insurance company where benefits brokers were my customers, towards the tail end of my career there, part of my job was actually designing the incentive programs for our largest brokerage partner, right? The broker that was selling the most amount of product for us, my job, they were my account. And so part of my job was designing these incentive programs for them where I was literally flying them and their families on all inclusive vacations around the world when they hit our sales targets. So I should have known better, but I just, again, I was so naive and so close to it that I didn't even like connect the dots. And that later came back to bite me pretty hard.
That's something that I heard about, and maybe on a much smaller level, but I know I had a couple of people that I grew up with that became pharmaceutical reps in Canada here. And the industry was basically parties and golf trips and just basically buying the business from the doctors, right? Regulations came into play about 15, 20 years ago, I believe, though, where they can't do that, but I'm sure they're circumventing it somehow. Uh, it's there's corruption up here too as well. It's just not quite as visible because we do have the full national healthcare system. I want to stay within really why we came here today, which is, the health benefit system, but for companies, for executives who are looking to save on those health benefits for their employees. So for the CEO or HR leader that's listening, explain in plain language, how does a traditional broker actually make money, and why does that create what you call an inverse market where higher costs mean more profit? And I know you've touched upon it in the last 45 minutes here, but let's simplify it, because once again, like I'm listening to you and I am wholly intrigued, and I'm definitely going to get your book, because this stuff is just, it's so incredibly interesting, and it should be to all citizens. But let's simplify it for the average business owner, HR leader, CEO. What does the traditional broker do? How do they make money? And why does that create that inverse market?
Yeah, great question. So again, most finance teams and HR teams don't know anything about healthcare, right?
Mhm.
That's not why they got into the business. It's a totally separate discipline. Just like, listen, I'm a business owner. I don't know anything about US tax policy. Okay. So I hire a CPA to watch my blind spots and make sure I only pay the taxes that I should be paying. End of story. Very simple. The challenge in healthcare is unique because about 81% of businesses rely on benefits brokers to play that role of the CPA, to use our metaphor, right? And so, but the challenge is that brokers are retail distribution. They get paid to sell products, not to provide you with financial advice. Okay. These are two very different value propositions. So when they're so let's talk about how brokers get paid. Brokers get paid in a variety of ways, and I detail all of this in a chapter in my book because it's so critical to understand this. Historically, brokers got paid a commission, right? So let's say, 5% is kind of the standard commission rate right now. So every year when your carrier renewal, your health insurance renewal comes out at the company level, and the insurance company says, listen, we're increasing your rates by 15% this year. Okay. And the broker says, listen, the carrier wants to increase it 15%, but don't worry, I'm going to take care of you guys. They go work out, negotiate with the carrier, and they get it down to 9.5%. Everybody high fives each other. The renewal gets signed. We move on to next year. See you in 12 months. Okay. That's kind of the legacy play. And so when that happens, if you're asking the broker to negotiate on your behalf, you're asking them to negotiate against their financial interests. Okay. So that broker in that scenario got a 9.5% raise that year. Okay. That's not sustainable. People are not very good at negotiating against their own financial interests.
Hmm.
So that's one way that brokers get paid. That's called the government deems that direct compensation. Now, some more savvy employers have said, listen, we don't want you to work on a commission basis. We're going to pay you a flat fee. We're going to pay you on a fee basis to avoid that conflict of interest. And that makes a lot of sense. But what those same employers don't understand is what the government calls indirect compensation. These are the bonuses and other forms of compensation that carriers and pharmacy benefit managers pay to legacy brokerage firms. So let's dive into that for a second. Indirect compensation. You've got new business bonuses. And not all carriers have these programs. So basically, if you're a broker that stacks enough business with one carrier, you will reach a certain threshold of production and you will get a bonus based on that hitting that threshold of production. Okay. So what that means is that you're not, as an employer, those carrier bonuses are meant to undermine the objectivity of the broker. As an employer, you're not going to get unbiased advice from someone whose revenue depends on stacking business with one or two vendors. Okay. That's a big problem. There are retention bonuses. Let's say there are other options in the marketplace that are a good fit for your company. you might not be shown those other options because your broker is getting a retention bonus for keeping the business in place with the same carrier. Again, meant to undermine the objectivity of the broker. Here's a new one that I just saw about 6 months ago, and it's probably the most pernicious I've seen. Some brokers are getting loans and lines of credit from insurance companies.
Well,
I mean, talk about conflicts. This is unbelievable, and most employers have no idea it's happening. I mean, I spoke with the CFO of a 50,000 life business a few months ago. They had no idea that their legacy broker got paid in that way. Okay. And mind you, since 2022, it's all supposed to be disclosed through something called a 408 disclosure. There's a QR code to it in my book. If you're a business owner, go get it, have your broker fill it out because it's supposed to detail all this backdoor money that undermines their objectivity. That's hugely important because you're relying on them for financial advice,
yeah.
right? You're relying on them to help you maximize your investment because you don't understand any of this stuff. So let's give you, there's historical precedent for this, what's about to happen. When the fiduciary standards started being applied to 401k retirement plans about 20 years ago, it forced financial planners to transition from selling products for a commission to selling services for a fee.
Mm-hmm.
And the government forced them to do that so that they were aligned with their customer to help the customer achieve their financial objectives. That's why that happened. And all the top, high-profile risk attorneys in the United States forecast that the same exact thing is going to happen on the health and welfare side of the house, where brokers are going to be forced to change from selling products for commissions and bonuses to selling services for a fee. And that's exactly how I built my business in 2018, is that we don't sell products. We sell services. What kind of services? Consulting, procurement, implementation, and management services. We are agnostic to the marketplace of strategies and solutions. Our job is to help you understand what is the best product and strategy roadmap for you and help you procure that, implement it, and manage it moving forward.
So what you're implying is that there'll be a fiduciary system implemented within the healthcare complex, right?
Yes,
Yeah.
exactly.
It's a little bit more moral and ethical in that they're selling strictly services, and so they're not feeling like, well, if I sell this particular retail product, I'll get a big bonus because it doesn't matter then anymore. They take that out of the equation.
Yeah, a quick story. When I was on the brokerage side of the business, I was adamant about being very transparent with customers and about how we get paid. And I remember one time I was showing a business owner an option that I really felt was the better option for them. They were an existing customer, so it's not like I had to win the business or anything. I'm like, no, I'm like, look, this is going to provide more value for your organization. It's cheaper. It has better coverage. It has better network access, all the things that they were looking for. And I showed them, hey, here's how we get paid. And this better option was going to pay me and my firm more money than the current plans that they had that were going to be much more expensive and didn't have as good a coverage. And because he didn't trust, because he saw how we were going to get paid, he thought I was only recommending this product, which, from an objective perspective, was absolutely better. It had lower rates, better coverage, better network access, like the big things that people look for. It checked all those boxes. But because he saw that it was going to pay us more, he said, no, we're going to stick with what we got. And that was one example. I was like, this is insane. I'm truly trying to help this person. And they still because I showed them how things actually work, they're still making the worst decision for their organization.
It's almost like they're just sticking with what they know, right? And this is what comes with a lot of the suspicion that people have these days, and the mistrust people have is like, well, this is the way we've always done it, so we're just going to stick with this, even though somebody offered us something better, because they probably mistrust that person because they're it's such a rat race. Donovan, what are 2 to 3 red flags that should make an executive, the person who's in charge of their company's health benefits program, 2 to 3 red flags that might say our current benefits strategy might be working against us, not with us?
Yeah. So I lay out a 6-step process in my book for healthcare transformation, how to reclaim the $4,000 per employee per year that most organizations are wasting. And the first step is the most critical. That is getting unbiased advice. Because if you don't get unbiased advice, you are going to get abused by the system, guaranteed. And there's two ways to do it. You can hire a fiduciary based management consulting firm like mine. There's a number of us in the marketplace, thank goodness. Or you can, if you're a larger organization, you can hire benefits expertise in-house, put them on your payroll. This way, you know they're aligned with you, right? They work for you, literally. But yeah, if as far as questions that the head of benefits should be asking their benefits broker, who again has so much influence over the purchasing decisions that are made. We're talking about $1.3 trillion, right? About 6% of our economy here. Ask them, will you serve in your contract as a fiduciary to us? And if they say no, that tells you everything you need to know. Because if they say no, it's because they can't. If they're getting paid backdoor money from insurance companies and PBMs, they can't serve as a fiduciary to you. It's illegal under federal law. It's called a prohibited transaction. So they can't do it legally. So ask them if they'll do that. And then also, under federal law, as a business, you are required to get this 408 disclosure signed by your benefits broker. And by the way, all the other vendors in your vendor stack. So get that, and that will give you a lot of clarity as to who they work for, what their incentives are, and how their recommendations may be biased.
So for health benefits managers, people who are responsible for their company, as we're talking about on this show, we talk a lot about families, kids, health, mental health. So when healthcare is misdesigned, poorly designed, how does that actually show up in the lives of the employees and their families now?
My goodness, this is such a great question. So, if you hang out in population health circles, they like to talk a lot about social determinants of health. And unbeknownst to most people, one of the biggest social determinants of health and well-being is actually financial stability. Right? So if you can't pay your bills on a routine basis, if you're stressed about money, you are not going to be healthy. Like, you're going to have problems. And so to me, this is where all of these different things intersect, is that health insurance is typically a top 3 expense at most businesses. It's typically the fastest growing financial risk on most corporate P&Ls. And it is undermining wage growth in a big way, because companies who don't know what they're doing because they're like asking the fox to guard their hen house, they have to play left pocket, right pocket. Okay, what do? Do we erode profit margin and our ability to actually pay our people competitive wages? Or do we pass more healthcare increases onto our employees in the form of copays and deductibles or premiums, or all the above? Right? They're left with a bunch of bad choices. My message to executives is no, go with the third way. Take back control and lead the way.
So you've helped employers cut costs, improve coverage. Obviously, that's your mission. Can you share a concrete story where a better plan design literally changed things for a family or an employee, or for a company for that matter?
Absolutely. So I'll give you an example of my very first customer when I went out on my own. Um, so the company had been in business for 35 years, and they'd been with a legacy broker all that time. They were always told, hey, there are only four options in the marketplace. You either self-fund or you fully insure with these 4 options, and that's it. And year after year, they're just getting crushed by like 15, 20% renewal increases. So I went in and said, after a year and they were a customer, but while they were a customer, I spent a year educating their executive team on, hey, here's how stuff actually works. And you can actually build your own health plan. Like, you don't need to use these like pre-packaged off the shelf products. We can actually help you put together your own health plan, right? Your own administrator, pharmacy benefit manager, networks, yada, yada. And so we did that. We built them a bespoke health plan. We saved the company over $3,000 per employee that year, got them better network access. And there was a couple employees who had, really serious things going on. we were able to steer them to higher quality providers and eliminate all their financial responsibility because they chose higher quality providers. Okay. So huge impact at the company level, huge impact at, for the high utilizers. And then here's the best part. The company was able to actually get an offer the following year and sell at a multiple that they were very happy with. Part of that was because we helped them control one of their biggest expenses. So they got a better multiple, got, I forget what it was, but it was a huge success story. And it was really proof of concept that when benefits professionals are liberated to give employers unbiased advice, how they can really move the needle. I mean, this is measurable progress. And so, going back to 2018, our average customer at Health Compass saves $1,856 per employee per year and has better coverage.
Hmm. Incredible. It's when we talk about corruption of the system, it feels like it's so large and widespread that it's almost a situation of if you can't beat them, join them. So the question I have with that, Donovan, is do you think that there are benefits managers within the company? So I'm talking about the people responsible for finding the appropriate health benefits program for their
Yeah.
company
Yeah.
that are also part of the corruption. Can they be bought? Can they be, kickbacks, things like that?
I mean, I'm sure there is some of that goes on, the whining and dining, that kind of thing, the
Sure.
relationship. But that's really, why I'm so excited about these fiduciary laws starting to be enforced in the United States, because one of the first things, since this is a very hot topic and we're trying to improve the decision-making process amongst executive teams for our customers, is establishing fiduciary committees and having a formal decision-making process, right? Because when we're just leaving it to one person, well, absolute power corrupts absolutely, right?
Yep.
So, creating these committees definitely helps create better decisions and outcomes. So, yes, I think historically it absolutely does happen and is happening. Some of that internal corruption. It's not, I don't think people think of it as in a nefarious way. It's just, hey, I've got this relationship. I know these people. They take me out to lunch. We go out to golf. We go to the game. It's that kind of thing. And I think relationships do matter.
Yeah, that's
It sounds right, but there also has to be accountability and transparency. And so that's where I'm excited. People think compliance is always this negative thing. It's just an exercise in compliance. Not when it comes to this. And I would agree with them in many parts of the employee benefits industry. Compliance is just something you check the box on. When it comes to the fiduciary standards, this is a massive opportunity. This tells the employer you have the power and the responsibility to demand accountability and transparency from your vendors. You don't have to be scared of these people. They work for you. Demand accountability and transparency. Huge opportunity.
is the fiduciary system something that was basically posited by the government and that branch of the government, or is this something that happened internally in the healthcare system? Like who decided that, hey, this is getting out of hand, we need to go to a fiduciary type system?
Yeah, so there was a federal law going back to 1974 that established the fiduciary standards, but the thing is that they haven't really been enforced.
Mhm.
And so that's been a huge problem. But there's you may have heard about some of these lawsuits with Johnson and Johnson and Wells Fargo over the past few years. I mean, the Johnson and Johnson story is unbelievable because there's so many layers of irony here because they're a drug maker. But basically, the long and short of it is that this employee was taking specialty medication, buying it through their plan, and the drug costs about $10,000 a month through the plan. Now, mind you, they only have to pay their copay, whatever, $250, whatever it was. But one day the employee asked the pharmacist, hey, what if I bought this drug outside of the plan? How much would it cost? You want to take a guess?
I feel like I'm guessing it's way lower than $10,000.
Yeah, yeah. The pharmacist said $78.
Yep.
$78. So when we talk
Jeez.
about spread pricing with legacy pharmacy benefit managers, this is what I'm talking about. Like Mark Cuban saying, listen, I'll take that $78 and I'll mark it up 15%. The legacy pharmacy benefit managers are saying, I'll take that $78 and I'll mark it up 10,000% or whatever that is.
Yeah. Is it just like it feels like they're throwing darts at a dartboard with a bunch of dollar amounts on them and just saying this is what this will cost and this is what this will cost. Like, are they are they doing it to just impress people? It's like, well, this would have cost you 10,000, but under our plan it'll be, $23 or whatever. This is what
A-
makes it confusing and stressful, right?
Right. I mean, again, the whole legacy system is designed to hide the price, and so you don't actually have a market
God, it's
price
yeah,
when you don't know the price. So,
no
so,
marketing.
so but I want to hit on one other thing. Like you mentioned, like
Yes,
yes,
sir.
this is if you look at the whole system in totality and you try to solve it, at a system wide level at once, it's too overwhelming.
Yeah.
To me, I can't do that. How do you eat an elephant one bite at a time, right? So this is why I was very intentional with the scope of my book and saying, listen, here's the power you already have. Here's how you exercise it. Here's how you implement it and use it. And let's start there. Let's go with the low hanging fruit, and then we could talk. Then we while we're doing that, we can spend the next 10 years lobbying Washington D.C. and hoping that they wake up. But in the meantime, let's solve the problems that we can and know how to right now.
Yeah, I love that. There's a lot of integrity that's required, a lot of leadership required in that path, in that journey. So you are pretty outspoken about doing the right thing, even when it costs you. I've learned that today and in the research that I've done on you and your company. So what have you learned about that leadership and integrity from taking this path?
Well, it's not easy, I'll tell you that. It's very tempting. There's a reason why McKinsey and Deloitte, they have a giant practice around helping supply side healthcare vendors make more money, right? It's a, it, you know, Rev cycle management, RCM, is $150 billion a year industry in the United States. And the whole focus of the industry is teaching health systems how to extract more money out of employers and patients through coding.
Gee.
And so Deloitte and McKinsey, and they've gotten dinged in this in the media. It's much easier for them to make money helping supply side vendors do that, helping the big pharmacy benefit managers increase their revenue than it is helping individual employers defend themselves and maximize their investment. So people in my core in the industry, I think we're very cognizant of the fact that what we're doing is extremely hard, but we know the law is on our side. We know it's the right thing to do. It's a different value proposition. And frankly, there's no one other than my colleagues. There aren't other entities in the market that have that position where our job is to defend employers and patients from the medical industrial complex.
Mhm. So what would you say to a leader, business leader? Let's say I'm leading a 300 person company and I'm just feeling stuck. Premiums are rising, employees are frustrated. You don't feel like I have the expertise or the courage to challenge the status quo. What's that first step between you and me meeting? What's the first thing you're going to do if we meet and we have this discussion?
Yeah. So what I mean, we like to use a diagnostic approach, and
Yep.
so the first thing we have employers do is just fill out a quick assessment. It's 25 questions. We call it the total benefits assessment. It scores them into 7 categories of benefits value. Most companies don't even have KPIs for what success is in this area. So this quantifies how they're doing in these categories of value, so they could see where the actual opportunities are. And then from there, we can have a discussion about, setting goals, developing roadmaps, and achieving those objectives.
Brilliant. If you could put one sentence on a billboard, and maybe it's already on your website, but that every CEO or HR specialist leader would see about healthcare, what would it say?
Well, I've got several billboards, but one would be, how much is your broker's conflict of interest costing you?
Do people okay, I'm gonna play the dumb role here because I'm from Canada. So that billboard wouldn't speak to me because I don't know what a broker is. But is that something that's fairly common language in the United States?
Yeah, I mean, 81% of businesses use a benefits broker.
Okay.
So
All right.
yes, most businesses are using them.
Okay. Because I mean, I've obviously I'm aware of insurance brokers, like for your home insurance, car insurance, and things like that. Being the Canadian observing from the north here, it's like I wasn't aware that that's something that's very ubiquitous in terms of a term in the United States. So say that again. What is the billboard going to say about brokerage?
How much is your broker's conflict of interest costing you?
There you go. There you
All
go.
right, here's another billboard. Stop overpaying for healthcare. Quit
Simple.
wasting. It's just stop doing that.
And that call, you know what, that call to action, that stop overpaying for healthcare, it seems pretty straightforward, and I love it because it is straightforward. But with, and I'm shifting to marketing, but it's like when you talk about marketing these days, okay, another company that says they're gonna fix something, right? And they're,
Yeah.
it's
Yeah.
it's so forth. So sorry, what does your company find is the best way to reach out to who your perfect client is? I mean, billboards are more brand awareness than anything, but what is the way that your company reaches out to businesses, organizations, to let them know that, hey, there's a better way?
Yeah, so just I think one of the things you're alluding to is that the insurance industry has been masterful in lowering expectations. Right? So think about it, you're an executive and every year your benefits broker walks in and says something like, "Hey, healthcare costs just go up every year. It's not a whole lot we can do about it." And so this is why many executives have checked out of these conversations, right? I mean, as a CEO of my company, if there's nothing I can do about it, why am I in this meeting? HR, you go deal with it, right? So you're asking HR, who usually has no P&L responsibility, to manage your second or third largest expense, which they frankly most of them don't really know anything about. So, and they're being led by the fox to guard their hen house. It's a recipe for disaster. Yeah, I mean that's the dynamic that we're dealing with. But I think to your earlier point that people were getting skeptical and asking deeper questions, that creates a tremendous opportunity. So yeah, have we figured out customer acquisition? I would say honestly, absolutely not. We really haven't. Our best customers have found us online and cold called us. We got a call from a large teachers union a few years ago, and they were like, "Listen," the executive director is like, "Listen, we've got some of our union members sitting on this insurance committee. They're smart people, but they don't know this health insurance stuff, and they're being asked to make decisions about this $65 million healthcare budget. And we're not really sure if we trust the district. We're not really sure if we trust the district broker. Can you just come in and tell us what we don't know?" So, so we came in, we did an analysis of their plans. We said, "Wow, the district hasn't gone to RFP for a new pharmacy benefit manager in 7 years. And by the way, you're with one of the worst ones. Push for an RFP in your committee meetings." They did that, and they got a new pharmacy benefit manager that saved them about $3.6 million last year.
In my career, I've met with hundreds, if not thousands of business owners over the last 20 years in what I do. And the number one mistake it feels to me like the C-suite or the leadership team makes is kind of burying their head in the sands to things they don't understand. And that's not just health benefits. It's, they think they know marketing, but they really don't. So they just kind of go, "Oh, my daughter in the back post to social media." Uh, they think they understand HR. That's one of the biggest mistakes is they don't understand people strategies. And I even hate the term HR, but this is another area where I feel like, a lot of companies, well, this is the way we've always done it, right? That's the old adage. We've always had
Okay.
this PBM, we've always had this particular benefits package, and it's worked for us. And especially if they are a profitable company, they generally go, "We're fine. Like we don't need to make more profit because it feels like more work. We're good," right? And that's so unfortunate because there are companies like you out there and other consulting firms that can help in not just in this area, but in many areas. So this has been a really eye-opening conversation, Donovan. I love it. This is why I wanted to bring you on the show. Where can listeners go to learn more about your work, your company, and getting your Fixing Healthcare executive summary or book?
Yeah. So if you want to turn healthcare frustration into a competitive advantage, wow, you have an amazing opportunity to do that. Go to fixinghealthcare.com, download the free executive summary of my book, and start following that roadmap that's there. The steps are clearly outlined. If you're an employee who's sick of rising healthcare costs or wage stagnation at your company, go to Fixing Healthcare, download the summary, give it to your boss, right? They're the ones who can actually solve these problems only if they have the clarity on how to do it.
And you had mentioned roughly 25 question assessment you have for companies. Is that available online or is that something you do once you've met with the company?
It is. So the free version of the total benefits assessment is available online. Once you you download the executive summary, you'll get a QR code for it, and go ahead and take that thing. It's going to give you a 32-page report with tailored recommendations, and then you'll also qualify for a free strategy session with my team.
To my audience, if you're in the United States, this is where you should be going if you want to take a look at your own healthcare benefits packages and what you're providing your employees and really get it assessed properly. And it could potentially save you thousands, if not hundreds of thousands of dollars. Donovan, I appreciate not just the data and the tactics, but the courage it takes to tell this story and to tell the truth about an industry that most leaders and most people really don't fully understand, and they keep it that way on purpose. So for those of you who are listening, if your gut's been telling you this can't be the only way healthcare works, you're not crazy and you're certainly not powerless. I will drop links in the show notes. You can connect with Donovan, grab his Fixing Healthcare resources, and start asking better questions about your own plan. If this episode helped you see things differently, share it with another leader, HR partner who needs to hear it. And as always, remember, showing up for your people matters more than just checking the box on benefits. We'll see you next time on Effort Over Results.